Nse Obot Witherspoon. Everyone calls me Nse, and I'm the Children's Environmental Health Network's Executive Director and have been doing this for over 2 decades now. So really honored to be helping to lead this organization that's been around 30 years now. And our basic mission is protect all children from environmental hazards. So as far as I'm concerned, it doesn't get any more basic than that. Just making sure our air, our water, our childcare, schools, homes, food are all as safe and healthy as possible so that children can have their best start out in life.
And can you tell me a little bit about what's new and exciting in your work since we last talked?
Oh, well, so we continue to ramp up continuously on the climate and justice equity connections. There is a very natural connection between our most vulnerable, our most susceptible populations, and especially children in those populations, because especially the youngest of them, they're the ones who are least prepared or able to speak for themselves, change their position in life. They're kind of born into the communities they're born into. And we know that our Black, Brown, low wealth, Indigenous children in particular tend to live closer to these extremely high areas that are impacted by climate, major weather patterns. So the compounding impacts that these communities, these fence line communities, as we call them many times, are facing on a regular day are only by chemical exposures, are only impacted by climate. So we're very much continuing to ramp up the climate side, the justice side of this, but not forgetting that we can't do that in lieu of reducing chemical exposures.
What's your favorite thing about what you do for a living?
The fact that every day I can get up, no matter what the weather's doing outside or how I'm feeling, and know that I am working each and every day towards the right side of this. I'm on the right side of this scenario. We may not see every single day the benefits to all the energy and work that we're so working hard on, but those milestones come and we acknowledge every single one of them.
What's giving you hope right now about the future of cancer prevention?
Thank you. I mean, we say often at the Cancer Free Economy Network and the Childhood Cancer Prevention Initiative that we are living in some unique times. There really has been this groundswell of enlightenment, I'd say. I mean, have we gotten all the way there? No. But between our federal government agencies, our state level agencies, there's a growing number of state cancer plans that are at least listening to environmental advocates like ourselves who are trying to bring available science and lived experience by having constituents and communities speak for themselves on how certain routes of exposures potentially could be reduced, if not eliminated, to make sure that we don't have more and more generations in each state falling into the same cycles when and if certain outcomes like cancer and long-term illness couldn't have been prevented. And I am extremely hopeful for our next set of generations. Many of them are leading their own organizations, going and testifying at world climate meetings, if not within the US and in their respective countries. And they just have this total can-do attitude. It's not a matter of if, it's a matter of when and how, because they recognize there is no plan B.
Have you seen any recent policy shifts, either at the state or federal level, that are really promising in this realm in terms of preventing cancer by reducing environmental exposures?
Yeah, thank you. For example, the Cancer Free Economy Network's been working with colleagues in California, Iowa, and Pennsylvania in particular. There is a growing number of these state cancer plans. So many states have climate action plans and they have state cancer plans. I do think our states and our cities have really been leading for a while now on preventive strategies, on air pollution reduction policies, air monitoring policies, on vehicle traffic pattern type of policies, on pesticide use, like integrated pest management policies, which are directly, we do know certain forms of pesticides are directly linked to childhood cancer. All of those steps in our school environments are making a difference.